Thanks for sticking along for our part two on Achilles tendonitis. So, part two, we're going to take a look at some of the biomechanics. So, first off, is your ankle needs dorsiflexion, right? Now, dorsiflexion is super important for squats, running, walking, all of the things that we need to be doing in our daily life for training, right? So, ankle dorsiflexion is the action of pulling your toes up towards your knee. This is dorsiflexion. So, we can test this by using a needle wall test. It's a great test that physical therapists and athletic trainers use all over the world to kind of measure people's dorsiflexion. All right. This becomes super important because we need the mobility of dorsiflexion to do a lot of these tests. All right. Dorsiflexion allows your ankle to bend so that your knee can travel over your toes, which is one of our primary ways for shock absorption during running, jumping, sprinting, lifting, pushing sleds, whatever you want to do. We need this combination of these motions to work together. All right. The problem is if you lack dorsiflexion, that force absorption has to go somewhere. All right. Where does that go? If it goes to the arch, this is one of the ways you can possibly develop like plantar fasciitis. As a PT, single plantar fasciitis, one of the first things I look at is what is their ankle range of motion, specifically dorsiflexion, along with looking at some of their hip strength, right? If you don't have dorsiflexion and that force goes even farther, it may go up to the knee. So your knee may move different directions to absorb this force. We call this like valgus collapse. Or you can just start loading more of your knee, and now you might have Achilles and patellar tendonitis, which is not a fun combination, right? But a lot of times, this force then gets transitioned into the Achilles because your Achilles and your calf complex is one of the reasons to absorb this. So if you're trying to land and absorb force, land on your toes and your heel goes down and your heel can't go down anymore, all that force is going to go right into that Achilles tendon. Right? Research shows that like dorsiflexion is one of the key, or a lack of dorsiflexion is one of the key factors for clients developing Achilles tendinopathy over long term because of the poor mechanics and the poor loading, which then gets transitioned into the Achilles instead of making its way through the muscles of your whole lower leg. So, easy test you can do to see if you have appropriate dorsiflexion. So, this is called the weight bearing lunge test. All right. So, you're going to find a wall. You're going to take your knee, put your toe against the wall, and you're going to slide your knee toward the wall while your heel remains on the ground. Ideally, you should also do this barefoot or in barefoot shoes because that'll give you a true range of motion. Most shoes have a little bit of heel in them. But all right, so being foot flat on the wall, keep your toe against the wall, and you're going to try and push your knee to the wall. Okay, if you can push your knee to touch the wall while your heel remains on the ground without collapsing your arch, so that's that arch from here. Instead of going flattening, it stays nice and high. Okay. Then from there, you scoot back, and you scoot back until you find a point where either your heel comes up for your knee to touch the wall, or you see that arch start to collapse in order to touch the wall. All right, those are your two keys. All right. Now, how we measure this is you should get about 10 centimeters or 4 inches, or usually what I tell patients, this is between 3 to 4 fingers width between your big toe and the wall. That'll tell you if you have the